name is Catherine Barnard-Kelly. I am a professor of health psychology. I am based here in the UK, but my work is global, and I work with a number of universities and other institutions across the world. So today I am going to talk to you about onboarding of new diabetes technologies. So in particular, I'm going to look at the psychosocial aspects of onboarding when it comes to a new diabetes technology. And the title of the talk, as you can see, is Right Patient, Right Device, Right Time. So let's get cracking. These are my disclosures. So we'll have a look at those. And this is really what we're going to cover over the next 25 and 30 minutes. So I am very, very happy for you to jump in at any point and ask questions. I've got a raised hand. Have we a question? I'm not sure we have a question. Okay, I'm going to continue because I don't see a question come up. But please do click in the question and answers. And the questions, any open questions will come up there and I'll be able to answer them as we go through. Please do jump in at any point. I'm ideally going to try and make this as interactive as we possibly can. And I'm happy to answer questions as we go along, or you can raise any questions at the end. So, which technology and for whom? What are the support needs of our patients, of our users? How do we know and how do we help them with their individual unique needs? What are the support needs of healthcare professionals when it comes to supporting our patients with these new technologies? What do we need to know? What do we need to be able to answer when it comes to these new technologies? And what are the outcomes that matter most? What is the impact of the technology? Is it hard outcomes such as glycemic control? Is it more soft outcomes such as quality of life, psychosocial functioning? What really matters? And to whom does it matter? What matters most to our patients and what matters in terms of the data that we need to collect to make sure that we're able to keep providing these technologies. And what I wanted to do, which I thought would be more useful than me sitting here talking at you for the next 30 minutes, is to go through a few case studies and to really see how the needs of people change. Even when they come into the clinic, it seems like their needs are very similar. So to start, we're going to look at the landscape. The reality is that the offerings of diabetes technology are very, very diverse, and they are growing all of the time. And often our patients actually are more aware of something that might be new coming to market than may be obvious in clinic. So they may be aware of it before we are able to offer it. We know that for many people, diabetes technology does reduce the burden of diabetes self-management for many, many people. It reduces anxiety, it provides greater control over diabetes management, relief of complex maths calculations, for example, with some of the bolus calculators. But not all users realize these benefits. And others abandon the technology very quickly after starting it. And a classic example of that is the continuous glucose monitors. We know that actually there's a very high uptake, and unfortunately there's quite a high drop-off after the first couple of weeks. And it could be that, quite frankly, the demands of the technology are just too demanding. The alarms, for example, with CGMs, the real-time CGMs, the interference in daily life, the interference drawing attention to diabetes, maybe at work and other social situations where you really don't want people to know about your diabetes. It might irritate your loved ones if it's waking them up in the night with the alarm going off. That can become really old really quickly. So, what are the expectations of potential users? And what are the expectations of healthcare professionals in terms of how users are going to benefit from these systems? And most importantly, are all of these expectations realistic? So we're going to look at the psychological factors that affect choice and the use of technologies, because this is about choice, and people choose to use them or to not use them in the way that's intended. But what people will do is use them in the way that meets their needs most. So we need to understand those needs so that we can best meet them. So the whole is greater than the sum of its parts. The reality is that we live in a world of high tech right in our pockets. Fast internet, immediate responses to most things. You can access most things very, very quickly from your smartphone in your pocket. The truth is, medical devices are simply not as sophisticated as some of these high-tech devices that we carry around every day. Neither are they as aesthetically pleasing. Medical devices can be ugly, they can be bulky, and they can be uncomfortable to wear. The reality is that for users, the engineering and biomedical excellence, they're taken as a given. People expect it to do what it says on the tin. They want more than that. What people want are devices that are discreet, that are small, that are accurate and effective, that are reliable, flexible and easy to use. These are heady demands of a piece of technology for diabetes management. And here are some quotes that people have told us over the years about what they want from their insulin pump, for example, or their CGM. They want a normal life. I want freedom in my life. I don't want to have to think about diabetes all the time. I want more headspace to do other things. I want to be happier. These are really big asks for a piece of diabetes technology, but they are achievable when we understand the individual needs of each of our users. Patients reasonably expect devices to be safe and reliable. Of course they do. In order for them to be fit for purpose, they need to be more than that though. They need to be personalized to each individual user. But it's really important when thinking about a device for a user in terms of compromise and balance. What are people willing to do to achieve certain outcomes that they desire? If we came up with a system, for example, that could keep people around 150 milligrams per deciliter and avoid 99% of hypoglycemia events, would people be willing to wear it? The answer is that yes, some people will, but some people won't. And it's understanding the balance between what are people willing to trade off to benefit from the new diabetes technology. And it's going to be different for everybody. So when we're thinking about technologies, let's get back to basics. SMBG. Self-monitoring of blood glucose devices, your finger prick stick, remains the cornerstone of diabetes management. It is an effective tool in supporting diabetes self-management, like with type 1 diabetes and with type 2. The reality is it's also quite useful to inform behaviour change. You can see what happens over a period of 2 or 3 weeks in response to a behaviour. Other glucose measuring devices, such as flash, for example, and continuous glucose monitoring, they're really useful, but often they're expensive and often restricted by many healthcare providers. So how do we make the most of the technology we have available that we can prescribe, for example, the SMBG systems? Do we go simple with the one on the left, or do we go complex with all of the additional information with the screens on the right that you can pull up on your smartphone? One meter can have such a range of functionality that goes beyond data. And it's about understanding what are the needs of the user and how much data do they actually need. If it won't fit in somebody's pocket, for example, the chances are they're not going to carry it around if they don't have a bag. So size is important. Health literacy, numeracy skills. There's no point giving somebody all of this information on the right if actually they have very limited health literacy or they're colorblind, for example, because they simply won't be able to see the different colors effectively on the screen. Flexibility. It's not about this or this. It's about this, then maybe more of this, and then maybe more of this. So it's always thinking about, what does the device do? What are the needs of the user? And how can we meet those needs dynamically as they get better and better and more comfortable with using the device? Again, self-monitoring of blood glucose is itself a backup for CGM and for flash, for example. So when you see something that looks a little bit odd on your CGM, what's the first thing that people do? What do we advise? Go back to your blood glucose meter and double check. It remains a really useful tool and shouldn't be underestimated. Meaningful monitoring, not just monitoring for the sake of it, but really, what do you want to understand from the data that you're going to get? Problem identification and resolution, understanding the data and linking it to behaviors to make sure that you understand the impact of those actions and how to change them if desired. It can be very motivating and engaging to see the benefits of your hard work showing on a blood glucose meter. It can also be deeply depressing when you don't see any improvement. And for many people, it reduces anxiety and hopelessness when you see that your actions are working. But some people need more data more often, particularly with type 1 diabetes, for example. So we know that Flash provides retrospective data and trends each time you scan, and we know that the newer models also have alarms. We know that CGM provides real-time data. We know that systems have undergone something of a transformation in terms of accuracy, reliability, and functionality. So we know that systems now are highly accurate, highly reliable. They have many, many more functionality features than the original models. And things are moving so quickly that actually it's very difficult in terms of approvals bodies, because when you do an approval based on evidence synthesis, you have to review all of the data. So it's really important to separate the earlier models from the later models, because they are a sea change in difference when it comes to impact and accuracy and utility. Data sharing. This is a really interesting one, because data sharing is absolutely fabulous for people who really benefit and like the backup of somebody else being able to keep an eye on their figures. For other people, the intrusion into what is a very personal thing can be very irritating. And we know, for example, with our teenagers, they get quite testy when their parents are texting them or calling them because the device doesn't respond quickly enough when they've treated a hypo, for example. So what you tend to get is some very testy responses back saying, I've done it. So data sharing is really important, but what's equally important is understanding the ground rules for the person who has the device and the person they're sharing their data with. With many, many of these devices, such as insulin pump therapy, CGM, Flash, etc., there is an issue around visibility of disease state. They do increase visibility and they can draw attention to diabetes. So it's really important to understand as a user, do I want that in my daily life? How will I respond when somebody says to me, oh, what's that on your arm? As people will. So it's really important to understand the benefits and the ability to incorporate into everyday living. If it becomes burdensome or interferes too much, then people simply will not use it and they won't benefit from the system. What does progress look like? We know that data platforms now strive to combine all available information generated by users. But when is there simply too much data? When do people become overwhelmed with all of this data? Which users want to announce physical activity, their meals, etc.? Who wants to take a photograph of their plate and enter it into their system? Not everybody wants to do this. When is it just data? And when is it insight generation? And actually, a lot of the DreamMed resources are all about insight generation and action rather than simply presenting data. Many people can figure it out for themselves, but many people struggle with that. So again, it's about understanding who needs what from this system, from this device. The reality is that the commoditization of these critical medical devices really does risk decaying clinical outcomes, worsening clinical outcomes, and potentially increasing overall health costs. We have to make sure that diabetes technologies are used by people who will benefit from them, and only to be able to do that must we understand what does benefit look like and how can we provide it. More data often just means more burden, but for others it means relief from burden. And we're going to look at that a little bit in the case studies in just a second. It's important to remember that glycemic outcomes don't necessarily improve with diabetes technologies. Some of the data from the insulin pump usage, for example, the audit data over the years, has shown that actually not everybody achieves an improvement in A1C. But there are other outcomes that are equally important. One, as a psychologist, I would certainly argue. And if we improve quality of life and we improve psychosocial functioning, we then create a space where we can focus on improving glycemic control. But if people are burdened, or if people are depressed, for example, or if people simply are overwhelmed currently by the demands of their diabetes, glycemic control is often very hard to achieve. So who is the right patient? Who are these people? How do we know? When our patient comes into clinic, how do we know? Because we know that one size fits nobody very well. And we know that different needs between people and within the same person develop over a lifetime. What somebody needs now, they may not need in 2 years' time, for example. It's where is the patient at right now in their diabetes, and what will this device do to help them with their management? So what are the support needs? Thinking about the user, it's okay to question the user about their needs for this system. Have you thought about different options? Why this device? Why do you think this device is going to help you? What will it do for you? How will that help your diabetes management? What will be different as a consequence of using this device, of living with this device? How will that make you feel? All of these questions are really important, because if a user doesn't really understand the demands of the technology and exactly what it can do, both in terms of benefits and limitations, the chances are they're not going to do very well with it in that onboarding process. So it's really important to be very clear about the benefits and the limitations of any device that we're going to prescribe. What about the healthcare professional? What support do we need to provide to the person sat in front of us to ensure that they're going to get the best out of this system, out of this device? Is it the right device right now for this patient? What are the alternatives, and why are they not suitable? Why is this device the right thing right now for this patient? What training needs do they have, and can we provide those training needs? Can we meet those training needs? What is the best way to deliver that training? Is it face-to-face and in group, or is it over the internet? Do we have within our team the skill set that is required to support this patient where they're at now wanting this device? Health literacy, again, really important to consider. Outcomes, which outcomes will we prioritize as we go through? And how will we balance the needs of our patients while meeting the needs of payers and healthcare systems? And it can't be forgotten that actually it is a balance, and often healthcare professionals are in the middle trying to navigate that seesaw. So what about a few case studies? So think about this person. What we do is we ask people to complete a very brief online kind of questionnaire. What it does is there are a few questions up front that everybody gets, and based on the answers to those questions, the next set of questions are really tailored to their needs. So for this person, some of the questions that they've been asked is, I often feel sad when I think about living with diabetes. My current therapy helps me to achieve and maintain my A1C. These are example questions. And they can agree totally, somewhat, or disagree based on how they're feeling right now. And they do this every time they come to clinic. And what we can see by some of the questions that they've answered are they're overwhelmed when thinking about living with diabetes. They're sad, they're scared, but they do feel that they can ask for help. They believe that their family and friends help them as much as they want them to. They do feel emotionally supported. They don't think that their friends and family worry too much. And they don't really feel that their friends and family act like the diabetes police, which we often get. So based on the answers, obviously it's a much broader questionnaire, which takes about 3 to 5 minutes to complete. This is a situation of this particular individual. Their knowledge of diabetes and its management is absolutely fine. They don't feel they have any issues in this area at all. In terms of the therapy that they're using, they're very happy with the therapy that they're using. However, they are having some considerable problems in their social environment related to diabetes, and psychologically they're finding it very demanding. So is a new device right for this patient at this time? Would a device reduce the psychological distress that this person is experiencing? Or would it simply add to the burden? If it improved visibility of disease, if it increased visibility of disease state, for example, through alarms or visibility of the device, like an insulin pump, for example, or a CGM, then how is that going to impact on the already difficult social situation they find themselves in? The chances are it may make it a lot worse. So how would a device reduce psychological distress? What are the most important outcomes here, and how can they be achieved? Really important questions to discuss with your patients when considering whether a new device is actually going to help. Thinking about case study 2, what we have here after their questionnaires, these are the responses that we've come up with as a consequence of their answers. So I don't feel I have the right device to manage my diabetes. So they're clearly looking for a new device, but they often feel overwhelmed when they think about living with diabetes. Okay, you look at their medical outcomes, they've got no complications, no issues around pregnancy, and their A1C is between 7 and 8.5. So again, here are the responses from the big issues around psychosocial, don't feel they have the right devices. So when you look at their situation, again, very, very high score on psychological impact and leaning towards therapy. So they clearly think that a device will help reduce the psychological burden that they're feeling with their diabetes currently. They've got plenty of social support and their knowledge of diabetes is absolutely fine. So which device will actually help to reduce this burden and maintain optimal glycemic control? What will help them? So take, for example, CGM or flash glucose monitoring. What would we prescribe with this person? Is there going to be additional stress, for example? How are you going to manage the alarms, if there are any? How are you going to manage the visibility of the device for this person? What support needs does this individual patient have to manage this burden? And how can you help them in order to maximize the benefits of this new device that they think is going to help them? Finally, case study 3, what we find here I put them all onto the one screen to make it a little bit more concise, is my friends and family act like diabetes police, and they worry too much about my diabetes. So again, they're happy with the therapy that they're receiving. However, they're really struggling in other areas. So for this person, will a new device help in this scenario? It might do. Is there something about visibility and alarms? Is it possible again to personalize the device to ensure that it has the minimum external impact? And what is likely to happen if we're able to get this right is that actually this new device may well reduce the anxiety of family members and loved ones. And it might encourage them to back off a little bit, knowing that actually your diabetes management is a little bit kind of safer or a little bit more cushioned because you have this new device. So it's important to think not just about the person, but the social environment in which they exist. And the reality is that progress, you have to define progress. It may be all singing, all dancing, all bells and whistles, but if the person doesn't need or doesn't want that, then that's not going to help them. Everybody is different and they all have unique needs. Low literacy, recognitions of patterns around time spent in each colour, for example, may be a much easier, simpler way to improve glycemic outcomes than all of that data that a CGM will provide. So it may be that an enhanced SMBG tool actually is what they need. In the UK, obviously where I live, 45% of adults have low maths ability. So sometimes even a bolus calculator that the data is regularly updated and checked can make a huge impact for people not having to make those complex maths calculations. People have unique needs. We all are different. And we know that people manage their diabetes in different ways, and that often that changes throughout their lifetime. So we know that we need to be dynamic in the tools that we offer them to help them manage. It's not who they are, it's where they're at in terms of how we can help them. Technologies are amazing. They really do help many, many, many people. They really do. But it's not a one-size-fits-all disease, and there's not a one-size-fits-all answer. What drives behaviour is here in the blue. How motivated an individual is to use a system, what they believe it will do for them, and how they feel about the benefit and the burden. That drives behaviour. And what we have here are the impacting factors. So, for example, the social support, the resources, the environment in which they live. These all impact on their ability to act, as do the devices and the therapy and the education they have. So we need to make sure that we provide them with the devices that meet their needs, with the education to use them effectively, and the skills to enhance their diabetes self-management to live the life that they want to live with their diabetes. Thank you for listening. If you have any questions, please let me know. If you'd like to contact me, your email, here are my contact details. Very happy to answer questions beyond this session.